wheelchair distribution around the world, around the globe, because I cover Asia Pacific as well, is more similar than it is dissimilar. There's never enough time, there's never enough people, there's never enough knowledge. So I think that's another reason I'm so thankful to be here this week amongst all of us. In terms of my disclosure, I do indeed get my paycheck from Sunrise Medical, and Sunrise Medical is the manufacturer of a bunch of different products anymore. My background, however, I'm a physical therapist, was trained here in the States, and I'm also a physio in Australia and ATP and SMS. I've been around the game for a while. And this morning I realized we've been learning, but I just have to take a little trip through anatomy to remind ourselves why manual wheelchair propulsion is so fraught with overuse injuries and why we need to use the technology, or at least consider the technology that is available for people if they want some assistance staying with a manual wheelchair. I will say that this has become a bigger and bigger and bigger category of devices used, particularly in Australia. And I think that's because it is better, or maybe just say well-funded in Australia. We do not need to document that there is an overuse injury. We do not need to document that someone has been a wheelchair user for a number of years. We can proactively add one of these power assist, power add-on devices at first injury or first usage of a manual wheelchair. So I'll try and talk about both U.S. standards and then broaden it to global usage and maybe what we should be thinking about. First, though, we have to just take a trip through anatomy and make sure that we are thinking about the shoulder and what we need to protect and why it's so hard to protect it. We all know that the shoulder is a mobile joint. It is made for overuse, overhead reaching, not for overuse. It is a very mobile device. And that's blinking, right? That's not my brain saying that that's happening. We'll see if it stays. And because it's made for mobility, it's not that deep socket that we know in the hip joint. So it's 3 times shallower than that of the hip joint. We know that we're relying on the shoulder muscles, the tendons, the ligament to hold it together. We also know that the biomechanics, the segmental orientation of that leads itself to overuse injuries, to stresses and strains on those muscles and the ligaments. We also know that the anterior muscles are much stronger, much bigger than the muscles in the posterior. We also know that some of the disabilities that tend to use manual wheelchairs have a discrepancy in innervation from anterior to posterior. So now we've got innervation changes between the two. When we are propelling a manual wheelchair, we know, is that my problem or? Just bear with us. I seem like I'm all plugged in. I'm not touching anything. The propulsion muscles, we know that the arm is held in about 70 degrees of abduction, and we start in that abduction and external rotation, and then move towards internal rotation. At the recovery phase, when we're done with our push and it's coming back, then we're into flexion and external rotation. That's lending us to have more well-developed anterior type muscles, all of the flexors and the internal rotators and the adductors. Think about the pec major, the pec minor, your anterior delt, and that's leading to your scapular muscles, your sits muscles, all of those that are already smaller, less strong, are weaker, and we're getting that muscle imbalance. We know that the rotator cuff is very important. We know that biomechanics and our body segment alignment is very important. Those push phase muscles need to be stretched. We need to have good alignment, and we really need to strengthen all of those posterior sits muscles, if you will. Also, motor control. In terms of muscle contraction, co-contraction release, that is very important in keeping that shoulder joint in a biomechanically effective situation or position. I don't need to walk you through all the research that exists in terms of pain and overuse injuries, strain injuries. We know that they exist. We know that they're very common at the shoulder, at the elbow, and at the wrist. These are chronic micro tears, micro traumas that happen at these joints. I just picked a couple studies showing that 73% of people that are using manual wheelchairs are reporting pain. And we also know that they're 6 times more likely to report pain at those joints in the upper limb than their able-bodied counterparts. We also know that the longer the time since somebody has been using a wheelchair, or in this case, the study was taken from the spinal injury population, the longer they've been using a wheelchair, the bigger the incidence of pain. Shoulder is the most common site, but we also see quite a bit of pain complaints at the wrist, okay, and at the elbow, and we know that it's multifactorial. It's not just from them pushing the chair, it's the transfers, it's the body misalignment, all sorts of things going to these pain syndromes. We also know that there's been lots and lots of studies done on how to push a chair. What is the best type of setup? What's the best ergonomics? How should we be instructing our clients to use and push their manual wheelchair? I tend to drill it down, boil it down, and say we need to push the handroom the fewest amount of times possible with the least amount of force possible while avoiding extremes of ranges of motion. That is what we try and do with our manual chairs, independent of rigid, folding, part-time, full-time, whatever. That's what the studies tell us. That has a lot to do with configuration and posture in the chair, has a lot to do with wheel access, orientation of the wheelchair. But again, I'm always drilling home to people that are new to this wheelchair industry. Hey, let's hit that push rim the fewest amount of times, the least amount of force, while avoiding those extremes of ranges of motion at the shoulder, at the wrist, and perhaps at the elbow. We know when it doesn't work out well, what ramifications can happen. First of all, we get a posture that's not supported. We haven't used angles, we haven't used orientations here in this wheelchair for a variety of different reasons. And now he's learning to compensate so that he can get support from gravity because we haven't provided it to him. The wheelchair doesn't fit properly. He doesn't have good access to those wheels. So all of a sudden now he's compromised in terms of the energy it takes to move around his environment, the places that he's willing to go, the activities that he's engaged in. And then all of a sudden we're, further increasing those muscle imbalances, causing repetitive strain injuries, reducing his function, providing him with poor skills, poor wheelchair functioning skills, and all of a sudden he's really losing potential about what he could do. So we try and optimize, and we do this lots of different ways. We try and provide contours of the seating systems, the back supports. We realign the orientation of the chair. We provide seat slope. We provide seat squeeze. We change the orientation. We change where the wheel is positioned in terms of COG. And then the physios amongst us, the OTs too, I guess. We strengthen and we reduce and we stretch the muscles that are weak and tight. We do all of those regular thorax things so that we can have as good a propulsion power as possible. We also try and make sure that people know how to best propel a wheelchair once we've configured it so that they can properly do this, right? So it's not intuitive sometimes about what the best type of propulsion stroke is, so we need to make sure that we offer that training. We know that the most efficient propulsion is when the axle and that center of gravity is forward, because all of those factors that are on the screen, it reduces the number of times that wheel needs to be pushed for a given distance. Also, it's easier to overcome inertia, less force is required, and also we're avoiding those extremes of ranges of motion, particularly shoulder extension, wrist extension. So we come up with training materials about how to push. We know that nice semicircular propulsion style will hit the rules that have been established. Hit the handroom as few times as possible, least amount of force, avoiding extremes of range. We know that we want the push phase to be equal to the recovery phase. We want gravity to bring that arm back so we're not using the muscles in that recovery phase. We think about good posture, good positioning over the wheelchair. We try and put the head over the shoulders, over the spine in its normal curves. We try and stack all that on top of a neutral pelvis. We try and make sure that in a typical body shape and size, that the tip of the middle finger is to the middle of the wheel. That's going to allow us that semicircular pattern. We try and load up the rear wheel so that 70 to 80% of that weight of the system is on the drive wheel. We know that casters are about turning, but they're also about drag and getting stuck into softer surfaces. And then we also have to think about wheel access in the lateral dimension. Have we provided that access? Have we added camber to the system? We also think about maybe the angles of the frame itself. We think about the front end angle. We think about the front frame inset. That's going to help stabilize the body parts. We think about the back height, the back angle, all of which is going to provide that support and stability to the client sitting in there and trying to push the wheelchair. But even when we have done all of that 100%, okay, sometimes it just isn't going to be efficient enough. It isn't going to give the people the freedom of mobility for the tasks that they want to be involved in. And maybe we can't protect the shoulders for the next 20, 30, 40 years of how they want to be moving around in this chair. So that's when we can start thinking about these power assist, power add-on devices. And I will say that as an industry, as a global industry, we have not done a very nice job of calling these things the same across countries. So I will use a nomenclature that we're starting to use in Australia and Asia Pacific. If it's a little bit different, you'll see images of what devices I'm talking about. I think we're getting better at calling power assist things where the person is actually still pushing, so it's just magnifying their push power. Power add-on is something that we're no longer pushing. The system is providing all of that propulsion. With some of the devices, we do a little bit of both, so it gets a little bit tricky to be that black and white. We also have devices that are mounted on the front. We have devices that are mounted to the back, and we have devices that are mounted underneath. This is a category of assistive technology that it's tricky. Some of the devices will hit 9 out of 10 of the boxes, but then there's one that really makes it tricky. So we have to make sure that we're really listening to our clients, figuring out what they want to do, where they want to do it, what are their must-haves. Think about transport, and we'll go through these, but I think there are so many devices because it's tricky and that they're very individual for what's going to work for a given individual in a given situation. So here you'll see some of the devices that I'm talking about, okay? Top left, we have a power wheel add-on. So that's taking away the normal wheels and adding a powered one. The chair in the middle, we're adding a different type of power wheel, and we're also adding a joystick. So that is, we no longer have to push that wheel. And then we have various devices that are added to the underneath or to the back of the chair, providing that propulsion. And we'll go through each of those, sort of their pluses, their considerations, what to think through when you're thinking about trialing these for your clients. First, though, I'd like to just better define how we should screen when we think a power assist, power add-on might be really beneficial. Especially here in the US, you need to determine how long they've been using their manual wheelchair, give sort of a history of that and success or failure of doing the activities that they want to do throughout the day. And when you think about those difficulties, think about terrains, think about distances, think about the endurance and the strain on the body to effectively push, okay? Remember that we can maybe make the distance, but we can't do it in a timely fashion, or after that activity, they're worn out, they can't do any of the others, okay? So you can sort of build on and they exponentially will affect one another. When you're looking at either power assist or power add-on devices, think about the transportation. Faith just did a really great job at thinking about transportation and airlines, and one of the things she talked about was lithium batteries. Okay, but that'll go across not only airplanes, but also cars, public transportation. How do they need to travel in that? Are they thinking they're going to stow it? Well, who's going to do that? Are they thinking they're going to ride in the device and the power add-on system? Is that available? Has it been crash tested? In Australia, it's very important that wheelchairs have been crash tested. It's part of the funding documentation, and it's tricky to get the government to pay if it hasn't been crash tested and approved. And I know that differs from country to country. So think about stowage, think about travel, think about how often that's going to happen and whether maybe the device needs to be removed. I also like to think through pain because this helps me justify why this power add-on, power assist device might be necessary. And we'll do a nice 24-hour pain diagram. What is the description? What is the pain cycle, meaning what makes this pain worse? What might improve this pain? What activities make it worse? Okay. What are the things that make it go away? If that's just rest, that's all building a case for why this power assist device, power add-on, might be very useful. We also need to think about the change in their functional capabilities or things that they're no longer able to do because of the pain, because of the effort that's required to move around their environments. Often I'll create a pain cycle so that I can document very objectively what's going on, so that I can build a case for how this power assist, power add-on device will help me reduce that pain. Also document if there's been a physician involved, what sort of pain management strategies have been done on the medical side. If they're on pain medication, is there a history there? Is the amount of medication needing to increase to manage their pain? And at the end of the day, we know that this is all about function and improving somebody's ability to do what they want to do in the world. So do an ADL chart. Make sure that you're documenting what they can and cannot do, and maybe how that's reducing throughout the last part of their life. Some other things to think about in terms of who might be appropriate for a power assist, power add-on. One of the big ones is that maybe somebody just can't be set up effectively, efficiently in their manual wheelchair. Because of body proportions, because of body size, they just aren't going to ever be a functional pusher. Maybe they have decreased endurance because of a respiratory, a pulmonary comorbidity, or a cardiovascular type of comorbidity. Maybe they have seizures, all those sorts of things. We already talked about how their disability might have stronger muscles in the anterior quarters versus the posterior. So no matter what we do, they're just not going to be as effective propellers. Their prime movers in the front are stronger than their rotator cuff. That imbalance due to either their body position, their disability, or probably both. And I always like to document when I'm looking at a power assist that they cannot effectively propel a manual wheelchair all the places that they need to go all day long, all week long. And they also cannot effectively use a power wheelchair. Some of these systems, power add-ons, are more expensive than a low power wheelchair. So I always want to document that power wheelchair is not an option either. And there's a variety of different reasons. They don't want one, they can't transport a power wheelchair, they can't get a power wheelchair up into their house, they can't use it in their house, whatever. Just make sure that you add that to the documentation. I also like to add some objective measures, again, a before and after approach to using a power assist, power add-on, or a change in functionality in the last couple of years of pushing a manual wheelchair, or just with the power add-on, power assist, things that they are able to do. A couple of my favorites are listed here. The first one is functioning every day in a wheelchair. And remember that this is a self-report. Detecting the client, so this is subjective, their perceived abilities on a number of really, really important and typical tasks and activities. This is, it is subjective, but it is an idea of how they think that they are doing using their mobility device. Again, a numerical scale so that you can show that before and after approach to how the power add-on, power assist is helping them. So you can see there's the 10 domains that the few hits, and those are really important everyday tasks that hit the majority of their ADLs. And then here, I don't know how well that's going to project on the scale. I'm sure a lot of us have seen this, as a lot of that work was done here at UPIT. But again, very typical activities that would be important to somebody moving around in a wheelchair. Okay, and what the scale is that they completely agree that they can do this particular activity, all the way to they completely disagree or does not apply, giving you a numerical scale and then showing before and after sort of results. I also tend to use the shoulder pain index. Again, that is a nice scale to use. It gives you an objective number at the end saying how much these particular activities cause pain within their shoulder, helping you objectify, hey, this power assist, this power add-on system will really help with their functional activities. And the whom, this would be very familiar to the majority of us. This is client-centered measure of their wheelchair and their seating system. This is a questionnaire, again, subjective into two parts. The first is looking at what the client's concerns are. Typically, we'll use the whom, sort of prior a seating assessment appointment. Part one is subjective. Hey, what are the client's concerns? What are they trying to accomplish? What are their goals? And then part two is the client satisfaction with in their current system or one that you're prescribing. You could use it before and after as well. Would be comfort, positioning, and a skin breakdown. This scale isn't as functional, isn't as activity related as probably the few. So I typically will use the few, but if I'm looking for more data, I'll add on the whom. And again, here is just another shot of what that test looks like. And again, their rating here, the rating scale is 0 to 10. So you're going to be able to find a bigger sway just because of the larger scale. A little bit older scale, that objective measure that can be useful is the wheel con. Again, this is a self-report questionnaire, but it's the confidence. And so this is about how they feel they're doing with their activity. So this one is quite useful as well. And those activities that are typically important to a client using a wheelchair. So negotiating all the different environments, activities or ADLs that are performed within the wheelchair, ability to navigate the world in terms of knowledge and problem solving, and then also managing social situations, participation, and managing their emotions. So this will give another idea of how they're feeling about this and how it's impacting their life. It's the wheel con. Yep. And just because of the platform I'm using, it's wheel is all capitalized and the CON should be not capitalized. But if you Google that one, that'll come straight up. And again, just to reiterate, especially if you're in a funding environment that's tricky, I would start to document through those objective measures and also what activities they're not able to do in their current situation and what activities they would be able to do that are important to them, part of their goal set, if they had this power add-on, power assist device, okay? And then again, just because we might need to knock out the capabilities or the functionality of a power wheelchair, make sure you document why that isn't going to meet their goals. Whether that's a space, it's a weight, it's a ability, a motor control issue, whatnot. Okay, so we will start to go into the actual devices here. And again, I'm going to name these pretty much or try and stick to it. Power add-on is going to be a device where the unit is controlled by a joystick and there isn't propulsion required on the hand rims, okay? These can be either caregiver controlled or the end user controlled, okay? We'll start with the power add-on and then move into the power assist. And I will also say that I'm highly generalizing across products. So take that with a grain of salt. And if you need to know particulars about things, go to the manufacturer's website or talk to your supplier or whatnot. But it's hard to get all these devices and group them into usable categories. So hopefully this will be helpful. Power add-on by definition is going to be a powered wheel of various different sizes, which attaches to the wheel, replacing its original wheel. And these are typically designed and most useful for clients that can't use a power wheelchair for cognitive reasons, for space, weight issues, but they no longer want to use a manual wheelchair. Also, somehow we don't want them to continue to push can't push on a typical hand rim. Okay, and there's a couple slides that are going to look like this. This is a document that we'll be publishing probably straight after the conference in terms of factors and considerations of all these different device types. I wanted to present this here before it was published. So apologies if the text is a little small, but realize that we will be publishing that, and by we, that'll be Sunrise Medical in the coming weeks. Very generic, and hopefully useful across not only products, but also across countries. So in this first slide, we're looking at the considerations of the unit itself and how it might interface with a wheelchair. So we looked at wheelchair compatibility, air travel considerations, the change to the wheelchair footprint, use in small environments, use for outdoor environments, and then wanted to look at extended distances, because there definitely could be a difference between, hey, being out on the soccer field and in the playground versus, going 10 kilometers down the street. So when we look at these wheel add-ons, the power add-on devices, they generally can go on most devices, whether they're tilt in space, folding, or rigid, but they might have a limitation into the size of the wheels that are available. Some will come down as small as 16 inches and then up to 24 inches, depending on the terrain that they're encountering. That might be really important. Most of these systems are using a lithium battery or a nickel magnesium battery that can be removed and can be transported, and there'll be a air travel document that is available for these products. Typically, the wheel add-on is going to add a little bit of width to the device, and it'll typically add a little bit of length to the device. Because we've added power to the system, we can't have that wheel right under their center of gravity, so it has changed that wheelchair footprint. Because these are driven with a joystick and they're sort of proportionally controlled, and they're only a small change to the wheelchair footprint, they typically do quite well in small environments. Okay, they're easy to navigate. We can make precise movement changes. Outdoor environments, again, depending on the device, depending on the wheel size, they do pretty good. Urban, outdoor, paved surfaces do quite well. When we get into really muddy or sandy terrain is when we have some limitations there. And I think this is a great solution for people that need to go longer distances, whether they're doing it as a user or doing it as a caregiver. This is the device that will just give added length to a manual wheelchair. They're not having to push it. It's letting them go for extended distances, for travel, for moving around in the environments. And then if we look at the client considerations, so this chart will do a segment on the actual device considerations and also the client considerations. The client considerations that were considered were hand function and strength for getting this thing on and off. General ease of use of managing and controlling the device. Options for degenerative, so if somebody's going to get worse over time. Considerations for stopping, so we've got some power, we've got some speed going with these devices. How easy is it to get to stop? Hemiplegic, and also hand function for controlling. Okay, basically with these, it's a joystick, so the similar things that we would consider with a power wheelchair apply. It's programmable, so it's going to do quite well with hemiplegic patients. It's going to do quite well with degenerative type of diagnoses. Depending on the device, it's either sort of easy to get on and off. Some of them are heavier than others. I'll go into that in just a minute. And in terms of the stopping, most of these devices will have electronic brakes. So the minute they come off of that joystick or the attendant control, the unit will stop. Okay, so again, we can't go through all of these for each device. These will be published in the coming weeks. I'll start to give you just a bit of a rundown. So here is a picture and sort of indications of the typical power add-on. Now again, these can be either user-driven or caregiver-driven or both, and it'll have some sort of proportional joystick that would have similar programmability as to our power chairs, and some sort of attendant control. A lot of these attendant controls will give the forward and backward propulsion, and then the steering happens via the push canes. So a little bit easier than your proportional joystick for caregivers that aren't used to using wheelchairs and joysticks. We find that this is a really easy way for maybe somebody in a group home, in a Tilton space, a seating system. The wheelchair is quite heavy, and this gives the caregivers a really easy way to move the client around the environments and out into the community. Okay. I'll typically think about this power add-on. Again, if they're not able to manage that manual wheelchair, power wheelchair just isn't a consideration for the reasons that I've stated before. Also might think about this power add-on for somebody that's in a Tilton space for that transition. Maybe I've got a kid that's 5, 6, 7 years old. It's really about time that we need to think about power. This can be a nice transition across, maybe before their home modifications have been completed, before their van modifications have been completed, just that nice little bridge across. Some of the considerations that are important, and I highlighted in bigger text here, just do remember that it will increase the wheelchair footprint. Again, that depends on the model, but it'll add a little bit of length and a little bit of width. It doesn't have the same capabilities as a power wheelchair. It's not going to go as fast. These guys will typically go, and I'm so into the metric system, I'll keep it that way. They'll typically go between 6 or 8 kilometers an hour, so slower than a wheelchair. And they obviously don't have the power, the torque, the wheel size, the caster size, so consider that. Some of these may affect the ability to fold the chair for transport, so take that into account. And then again, depending on the device, some of these wheels are sort of 6, 7 kilos. So they probably are something that the client and the caregivers aren't going to want to take on and off multiple times throughout the day. So I'm going to think about this system here. If I've got a public transportation or a modified van, so they're just going to get in this thing and use it like a power chair. If I need something that's more easily taken off the system because they have to fold it because they're transporting in such a way that I do need to take it off, there are quite a few devices out there. So this is some sort of, again, powered wheel that's attached to the system. And these are more generally underneath the body of the wheelchair. And you can see these different devices. It depends on how far they stick out the back. But this will, again, either be attendant controlled or a joystick somewhere on the system that fully takes over the power of the chair. So typically no manual pushing happening. Okay, and we have those same considerations that I talked about before. And I'll show you those in particular. This is the Benoit light drive. Basically, you add a power wheel system onto the back of the wheelchair. And so you have wheels that are in contact with the rear wheels and makes the rear wheels spin. It's multi-part system, weighs about 7 kilos in the motor component, and then the battery will weigh about the same, maybe a little bit more, 8 kilos. This one goes a little bit faster. It does have a limitation in the width. It'll only go up to 19 inches wide, so you do need to think about that. But when you take it off, it actually makes a really nice compact, and it's pretty easy to get on and off the system. Couple of considerations. Again, it's not going to have the same sort of capability as a power wheelchair. Okay, it does, if you want to break it down to those lighter weight components, it's a couple steps to remove, but simple enough. And it does create wear and tear on the tires. You are rubbing, creating friction on those tires. So they're going to have to maintain those tires probably about 6 months, depending on how much and how far they're going to use the system. It is also a bit tricky to install onto chairs. So you just need to make sure that the supplier is doing a nice job there, and then the system works quite well. We also have a number of power. And let me say just one thing, sorry. This can have either a joystick at the front for the user, or it can have a little attendant sort of throttle thing. So that can be either usage point. There are a number of manufacturers that make very simple power packs that again will add on to the bottom of the wheelchair, hook on in various different ways. And these more typically are just attendant driven. Okay, so you'd have this for a client that doesn't want to be in control where that's going. Has a forward and reverse, and the attendant is still in charge of doing the steering here. Very easy to use. They either have some sort of a throttle or some sort of switch and can come on and off the chair quite easily. They do stick out the back of the wheelchair footprint, so either consider whether that's a doable hurdle, overcomable hurdle, or can you put some sort of stroller handle on there to bring the attendant further away from the chair. Again, it's going to have less capability than a power chair, and just make sure that you understand that the foldability is going to be restricted unless you remove that power pack. The R20 tries to overcome some of those hurdles. So we've made a much smaller wheel in the center, super easy to get on and off. It has a little thumb switch, or just a little silver button, which gives it the power. And then of course you have speed adjustability, and always managed by the attendant. Super lightweight, super easy to use. And the benefit of this one is that you can fold the chair to about its same width without removing the device. Also has a nice little hook so you can pick up that wheel if you don't want to drag it on the floor when they're not using it. It's also really easy to remove. The considerations, it's a little wheel there. The minute you get it in some sand or some wood chips or a big incline, it just doesn't have the power, the performance of some of the other devices. And that's what that looks like when it's folded. And then we have any number of front pull devices. Pull devices, front arm bikes, these are where we somehow attach this system onto the front of a wheelchair and then gives us the pull power. A couple things that we need to remember about these pull devices is that it's going to change the seat slope because we need to lift that chair so that we can get the casters off of the ground. So if that's important in terms of stability, posture, skin protection, we need to consider that. Obviously, it makes this wheelchair footprint quite a bit bigger, but this is the clear winner when you want speed and you want performance, you want outdoor terrain navigation. And there's all sorts of different levels of this, from little 8-inch wheels in the front all the way up to some monster wheels. So in terms of those front bikes, some compatibility issues, they do need to have a rigid front end. Most of these, you can put them on either a folding chair or a rigid chair, but you just need the front end to be fixed so that those clamps can go on there nice and safely. Does make the wheelchair footprint a lot bigger. And the biggest thing with these guys is that you need to consider how capable your client will be of putting this thing on and taking it off. Okay, and if they need to travel with it, where is this big bike gonna fit? If they need to put it into their car or into their van. Okay, in terms of the slide here, also in small environments, you've got a big turning radius. So it's gonna be a clear winner for those extended and outdoor terrains, but not so useful indoors. The other things I like to consider when I'm considering a front bike, and I have lots of clients that come to me and they're like, I need this, this front arm bike, this is great. I think, okay, do you have the trunk stability? Do you have the upper limb stability? Do you have the motor control? Can you get in and out of the system? How are we gonna dock it? Each device will, it'll differ how those clamps are attached or how the bike is attached to the frame. Some are getting very clever, and when the bike is removed from the system, there's nothing left behind. Some more bespoke wheelchairs can actually weld in as part of the frame the attachment locations. Sometimes you just have to consider whether the legs are safe or where those clamps are, if they're in the middle or to the side. So just consider what the mechanism is. What weight is added to the chair? Does it stay? Can the client effectively remove and put this back on? Some of them will have a little bit of a kickstand, so it'll stabilize, making the whole process a little bit easier. So think through their upper limb functionality, the safety, the trunk balance required. And some of the systems do not have quad grip abilities, so I have to have really nice hand function to be utilized. And then in terms of performance, there's a whole host of different types and different performance levels, if you will, all the way up from little 8-inch wheels, sort of stick devices, all the way up to the Baytech Monster, which will handle all sorts of outdoor sort of terrain. So where do they want to go? How do they want to use it? What are their goals? And can we overcome some of the considerations about the size and weight of it? And then we move into what I'll call push devices. And this is where we're getting a whole lot of gray. Sometimes they'll be pushing it, sometimes it'll be a complete power add-on. It just, the technology is advancing and figuring out what people really want to use. So they're sort of muddying the water. But here I'll define it as a unit that is clamped somehow to the underbelly of the chair, whether it's a fixed chair or a rigid chair, and it is pushing the device from this motor wheel. So easily removed. This is the lightest weight of all the units that we've talked about. Okay, and depending on the unit, it adds a little bit of length, but it definitely doesn't add any width to the system. So in terms of the product considerations, again, we'll go through compatibility, air travel, change to the footprint, these will be attachable to either folding or rigid chairs. You just need a different clamp system. Just remember that most of these will leave the clamp behind. Is that extra weight any hurdle that needs to be overcome? Most of them will have a lithium battery that's easily removable. That'll reduce some of the weight of the system if you're donning and docking, and they'll have air travel certificates so they can be utilized. Again, depending on the device, some of them are a little bit better at staying within the wheelchair footprint for the length. Others are sneaking out the back a little bit. Just determine whether that's a big hindrance or not. These are a little bit trickier to use in small environments where navigation and precise navigation is required. So if you're in a shopping center or if you're on the expo floor, these require some wheelchair navigation skills, some just wheelchair skills in general. Because most of these devices, I think of it as like cruise control for your car. This thing is going and you are in charge of stopping it. And so some clients that just isn't a great system for, others it's great, right? So we just need to consider how this differs from, say, a power assist device. Very good for extended use. This is where these came out of, and great for sort of uneven, sort of urban terrains. Okay, that's really where they're a winner, is in the weight, in the donning, doffing, and the extending your push factors. Again, depending on the unit, you need to consider your hand function. So for both putting it on, taking it off, and also controlling the device. They're getting better at programmability so that the device will go and it's easier to manage its speeds. Some of them also have very good Hemi options so that you could do this quite well with just the use of a left side or a right side. One thing we do need to consider is, do they have the hand control, the strength, the motor control for stopping the unit? These will really increase their speed. Will they be able to navigate the trains and stop when required? And so if we look at what these look like, again, they'll be propelling from the back. Propulsion can be limited to just steering, navigating, okay? Depending again how it's been controlled and which device we're talking about. And again, doesn't take away any of their wheelchair navigation skills. So you can still pop a wheelie, you can still turn within your same footprint in most cases. So the advantages, and we'll sort of break these up. I think they're a little bit different from manufacturer to manufacturer. The Smart Drive is definitely a winner in the overall weight category, coming in at one of the lightest out there. Super easy to get on, super easy to get off. It's compatible, again, like many of the devices in this category. Quite powerful, can manage inclines, declines, can manage semi-firm terrains. And then the nice part is that it pivots on either the axle plates or on the camber bar, so that you still can pop a wheelie, you can still navigate some curbs. But the considerations with all of these power push devices is that it's a bit like cruise control. It is going, and so their wheelchair skills are going to have to be amplified. So if they're coming up to a curb at a bigger speed, they better be able to pop that wheelie. navigate in terrains, navigate with people around, and just making sure that they're paying attention. There is a learning curve, but again, the better their wheelchair skills are to start, the shorter that learning curve will be. And also, if you get into really thick sort of soft terrains, it can get bogged down in the wheel, as you'd expect, if you're not getting bogged down by your casters first. There's lots of different ways now to drive or to control the smart drive. We have a system of starting with a push and then it maintaining like cruise control. There's a double tapping method. There's now a switch control where you hit the switch and that will get you to a pre-programmed latched speed. And they also have the new speed dial. So this is taking away some of the tricks with the cognition. With the speed dial, I think that's a great addition. They ramp that thing up and then would control, navigate directions via their hand rims. And then if we look at the Smooth, again, very similar in that it's very portable. It's about the same weight as that Smart Drive. The Smooth is a rotating caster, so that's a little bit different. It feels a little bit different if we compare that to the Smart Drive. And this is also using a large dial that is put onto the side rail of the chair, and so they turn that up to increase the speeds. And just like the other push devices, very important that they have a good set of wheelchair skills prior to use. They need to have that good distal fine motor control for stopping the wheelchair because neither of these have any sort of electronic braking. It might be a little bit old on my slide here. I think you don't necessarily have to be in the trailing position anymore. Let me go back one slide. Here in the picture, we have the system in the trailing position. And in earlier devices, it had to be in that trailing position in order to activate for safety reasons. But I think there's a bit of a software change where you can still activate the device if it's in the 4 position. That was just something that was a little bit of a learning curve with this one as well. And again, because it's that sort of cruise control, you need to consider using it in small urban, environments. The last category that we'll talk about is Power Assist, the wheel add-on. So now the client is still pushing the wheelchair with their normal hand rims. It is just amplifying their push, upwards of 80% power add or 4 times their push, depending on which device we're talking about. Now the motors are incorporated into the wheels, and then these wheels are replacing their original wheels. These can be popped off, put their regular wheels on if they don't want to use them for a given location or day. So it really does reduce the push force required and the amount of pushes required. In terms of the compatibility, these can be used on manual chairs, rigid and folding. Okay, we could also probably use these on a tilt-in space. Depending on the unit, the batteries are either in the wheel themselves or in a removable battery. So just check these devices to see whether that impacts air travel considerations. They do make the wheelchair a little bit wider. And sometimes because we have that extra speed and weight in the back of the wheelchair, we do need to move the center of gravity backwards. So it will change that footprint and also change the ability to do wheelies and that sort of thing if you've had to move the center of gravity back. This device is a clear winner in small environments because it is just magnifying the power. If you need navigation, but you just want to reduce the force required, this is probably one of the better devices that does that. It also is a clear winner in the distance game because we just don't have to push as much. We don't have to push as hard. And depending on the device, they're getting better and better at having cruise control so that your push will actually be extended for longer, and also having sort of slope control and more programmability. In terms of the power add-on, I won't go through all of these. I sort of put them into advantages and disadvantages. One thing with this Power Assist is that they're continuing to push. So they're still getting the range of motion, they're still using their wheelchair skills, they're still getting that activity, but I will be the first person to tell you that a wheelchair shouldn't be an exercise device. It's a mobility inclusion device. Okay. Most of the devices will decrease that energy expenditure somewhere between 70 and 80%. and have advanced programmability to help with strength differences from side to side. And you can also adjust how much force it helps and what speeds it will allow. A lot of them will also have anti-rollback or will have hill holding support. So when you're on those non-level surfaces, the device won't get away from them. Okay. One thing that they don't have here is the electronic brakes. So you need to be able to stop the system for, whatever speed it's going. You can always take off these wheels and put on another set or put on their regular set. And again, just that power add-on is easier to manage because you are in direct control. If you want to go a little bit fast, you give a little bit of a push. The considerations, this is one of the heavier systems out there. The only one that's heavier is probably that power, that arm bike add-on. Okay, it does increase the overall width. And I've talked about all those before, okay? And I think that's why this is such an incredible category of AT, because there's so many considerations and concerns. And again, this will differ by model. There's quite a number out here. What you might need to consider is the weight capacity. Some have a lower weight capacity than others, so make sure that that's part of your decision-making process. Where the battery is and the type of battery is also important. Some of these are using nickel magnesium batteries, some of them are using lithium. Where are they attached? How do they charge? That should be all part of the decision-making process. Make sure that it works well for your clients. And then because these are typically used for our more active clients, I always want to consider how that wheel comes on and off, because most of these clients will want to be transporting the chair independently. And as we already discussed, these wheels are 6 to 7 kilos each. So I don't want to make it harder to get on and off. So look at how they attach. Look at where the battery is located. Can you take off some of the weight in different pieces? Okay. It's a lot of information all in 1 hour, and I think I did it. I might even have a couple extra minutes here. Do want to note that there are a ton of references in here that people have been doing research on power assist, power add-on devices for quite a while. So I've referenced them. And I will now take questions. And I love your Michigan shirt, by the way.
Thank you. So my question is, especially with the front add-ons, they have such a high rate of speed. How do we think that affects the manual wheelchair or like the safety of the rider? Like I know I had someone come to one of my United Spinal events with one, and I see all the guys trying it, and all of a sudden they're going 10 miles an hour down the road, and I'm like, I don't think your manual chair can do that. So I guess that's kind of one of my questions is what is it, because I don't think those manual chairs have been tested for that speed. So I guess I was just asking.
And I'm going to try and wear at least 3 hats right now. So in terms of my physio hat, well, no, let me put my transportation import hat on first. There's a limitation in speed of power wheelchairs in Australia. Maybe I'll just talk to Australia, where all power wheelchairs are limited to 10 kilometers per hour. These are being imported into Australia as non-medical devices, so like pedalettes, like the bikes. So in basically that's getting them through customs, and then people that want to use these sign a waiver saying that they will not use them on public roads, they will not use them on public sidewalks, they will only use them on private land, which we all know is complete hogwash, but that gets them over or beyond the 10K limit. So there's that issue. Yeah. And then in terms, I'll put my clinical hat back on. They can really start moving very, very quickly in terms of, do they have motor control at that speed? Do they have the motor control to stop it? If the electronic brakes work, do they have trunk control? All those sorts of things. I worked in spinal cord injury for a long time, and one thing I know is that a spinal cord just magnifies somebody's personality. So you sort of have to consider that as well. Put my Sunrise hat on, and I will tell you that we will warranty anything that's a manufacturer default for the chair. So all of this stuff is considered a clamp on, an additional accessory that, you know, if this caused a fracture in the frame, a fracture in the camber bar, whatever, so be it. You know, the setup is really important so that you get those casters up and off the ground. We won't put them on a carbon frame, you know, so we try and limit the possible injuries as much as we can. Yep.
Let me get you the mic.
And how are you managing that?
At that time, my role was not as a clinician, I was as the president of the association, and so I just kind of let people do exactly. And I haven't had anyone come to me and ask for one, so I haven't had to necessarily jump off that bridge yet.
So just for the recording, her answer was that her role was with United Spinal. She wasn't as a clinician during that time, so she was trying to direct and guide. I'm going to let you take.
Okay, this is just kind of in response to that, because we've had, I work at the VA, so we've had a lot of veterans just come in and want it, and we've had vendors out to kind of show us the different devices, and we've tried them. And I've had my own concerns because one of our clinicians, he got in a pretty bad accident on one. But that also reminded me that the clinician that got into an accident is not used to how his wheelchair handled. He doesn't use a wheelchair. So I think somebody that is, it might be good for somebody that really understands their wheelchair, has been in it a long time, and understands kind of how it handles around turns as well too.
Yeah. But then that could give them a false sense of
That
security
too. Yeah,
too,
that's
right?
true.
Like, I know how this thing works without this big addition, without all this speed, and the seat slope is completely different. So, you know, caution is great with this device and sort of slowly learning.
Another thing that you can take into consideration is most of these devices can be programmed by the manufacturers to limit the speed. So they might have a top speed of 15 miles an hour, but you could set it to be 6. And then that way you don't have to rely on them making that decision, but you can max out that speed based on your safety and clinical judgment.
One thing that we're going through in Australia is our NDIS, our National Disability Insurance Scheme, is all about choice and control of the consumer. So we'll have guys coming and saying, I want this, you know, monster bay tech. And the clinician will say, I don't think this is clinically necessary, effective, safe, whatever. And then that person will just go to someone else and eventually probably get one, you know, assessed and approved.
I was just going to say for the power assist wheels for pushing, that the other thing I have found for considering those that I don't think I saw just to share is how to turn them on and off. That makes a big difference, I think, in choosing which one works best for the person. And then are you going to upload the slides to the portal?
I will.
Okay,
Yep.
cool.
Yep.
Thanks.
We have time for one more question.
And I guess on that, there's so many considerations for these devices, and that's why I sort of put that orange slide on there, because I felt like we just had to at least think through the broad categories. And that's what makes this tricky is that there are just so many considerations both for the client and the product.